Welcome back. Here's another look at the latest COVID-19 numbers from Georgia's Department of Health. More than 36,500 people have tested positive here in the state of Georgia. 1,500 people have died. Now, we know you have a lot of questions about the information you're seeing and hearing. So 11 Alive medical correspondent Dr. Sujatha Reddy is here helping to give you the facts, not fear, about COVID-19. Let us know if you have a question by texting us at 404-885-7600. Now, let's welcome Dr. Reddy back to our show. It's nice to see you again. Happy Friday.
Happy Friday, Christy.
All right, the first question comes from Anna. She texted us this. I want to travel down to Florida to see my mom. Every time I fill up at the gas station, should I use gloves at the pump?
Yeah, and that's a really good question. So there's no harm in using gloves if you have them handy. Another option, and this is what I do when I pump gas, and I actually did this even before COVID-19, I keep some sanitizer in my car. So what we're worried about is if someone before you had COVID-19 and sneezed, let's say, on the pump, and you touch it, and now the virus is on your hands. While gloves is one way to keep that virus off of you, if you touch it with your hands but are very cognizant and careful not to touch your eyes, nose, mouth, you're going to be okay, especially if you have hand sanitizer in the car or a wipe or can wash your hands. You can get rid of that virus. So both options are okay.
Okay, good to know. Now, Jill wants to know this. She says, do you think the virus will have a resurgence in the fall, even if we keep up strong safety precautions?
Yeah, and I think, that's the million-dollar question. And, I don't know if we're going to have a big jump in the fall. It's a possibility, especially if we think about over the next several months us kind of getting back to our normal lives. What I think is going to happen, and she's right, we're all being very careful. We're different people coming out of shelter in place than we were when we went into it. We are now very cognizant. We're all aware of the recommendations, that social distancing, wearing masks. We're being very careful. And I think what we need to accept is, in my opinion, we're going to have a number of new cases. I think it'll be a much lower number, but we're going to have new cases every day. But we also are learning how to treat patients with COVID-19. I think we're not going to overwhelm our medical system, but I think we have to accept this virus is here. It's going to be around, but we're different people. We know how to help ourselves as much as possible to protect ourselves. And I think in the medical field, we're learning how to better treat patients with COVID-19.
And that's why we're all talking about this being our new normal, getting used to those masks and procedures. Okay, exactly. This next question is from Carl. Said, my mother's in her late 70s fighting COVID-19. She's usually in good health. So what's her best line of defense in beating it?
Yeah, so I wish her well. It sounds like from the way he's asking this question, I'm hoping she's at home and not getting seriously ill. And I think it's important to remember that still 80+% of people, probably even more than that, will recover after a mild illness and not have to go to the hospital. And I hope Carl's mom is one of those. So what you do if you're at home, I think, is just the same things you would do if she had the flu. Keep hydrated. If your temperature is bothering you, meaning it's making you feel weak, treat the temperature. There's some data that perhaps vitamin D can help. There's no concrete studies, but one vitamin D supplement that you can buy over the counter isn't going to hurt anything. But as far as at-home medication, it's just really treating the symptoms, which would be the fever, possibly headache, those type of things. There's a lot of I'm going to call it email myths out there about what you can do, but there's no real concrete scientific data recommending anything specific for at-home treatments.
Lots of rest. We're thinking about you and your mother, Carl. Good luck. Crystal asked this. She said, how likely am I to contract COVID-19 from cleaning and servicing portable toilets that are on construction sites, as well as testing sites at local hospitals?
So, I think it's a good reminder for us, and this is a good question, to think about how we catch COVID-19. It's really from droplets, so mainly person to person, less likely with surfaces, as we talked about in the first question about the gas pumps. So in this instance, I think she should just wear her mask, obviously. I think if you're cleaning with a lot of sprays, I think goggles in this case would probably be a good thing, some sort of eye protection, and a lot of gloves, obviously. You're cleaning toilets, so I'm sure that's what you do anyway. But as long as people aren't around you, I think if you take those precautions, I think you'll be okay.
Okay, another viewer wants to know, can in-ground saltwater pools spread the virus? Are they safe to swim in with outside family members?
Yeah, and I think this is a question that we're all going to have to wrestle with as we get into our normal lives and possibly think about going to the neighborhood pool. So, chlorine and a high concentration of salt will kill bacteria and will kill viruses. So, I think the question about the pools being safe, the water is safe. We know that the chlorine, the salt will kill, most common organisms, including coronavirus. This coronavirus is killed with easily with soap and water. But as far as other people, that's where I think actually your risk comes in. The people you're inviting over, have they been socially quarantined? Are they practicing the same measures you're practicing? What's your risk from them? That would be more my concern than actually the swimming pools. I think the swimming pool water is going to be safe.
A lot to think about before you have a social distancing pool party this weekend. Dr. Reddy, thank you so much for joining us this afternoon.
Thank you.